The coronavirus outbreak has brought the world to a standstill. With businesses around the world shutting shop, the economy taking a severe hit, and many countries being in lockdown, all of us are trying our best to combat this situation. However, in this pandemic, there's an army of people. In other words, the actual superheroes of the society, pledging their services as well as their lives for the sake of humanity and our safety. The medical community, including doctors, nurses, and a lot of other medical staff, are the warriors who are fighting this disease on the front lines, and are putting their lives for us. So today, we have one such warrior with us, and I take immense pleasure in welcoming Dr. Abhilash Mali. Thank you so much for coming.
Thanks a lot. Yeah, my pleasure.
So let's start off. Can you please tell us a little bit about yourself, where you're from, and your background and stuff?
Actually, I'm from Buldana in Maharashtra. It is a small town in Maharashtra. I did my undergraduation MBBS from Jalgaon, and right now I'm doing my post-graduation. I'm a second-year surgery student at Dr Panjabrao Deshmukh Medical College, Amravati. Yeah.
That's good to know. Can you tell us what motivated you to become a doctor?
Actually, I'm from a very humble family. It was from them which came to me that I want to work for the society. My mom, dad, they're working for society since I'm understanding it. So they were working in the education field, and I was always there, looking at them, looking up to them, that I want to work for society. And it was the best way. The medical profession was the best way to serve the society.
Yeah.
When I gave my 10th boards, that time I decided to work for the society, and I thought the medical profession will be the best for it. So I gave my CET, and I joined a medical college after that. And yeah, I'm here.
It's nice to know. That's good to know.
Actually, it gives a other kind of satisfaction when you work like this, and I'm happy to be a medical profession.
I mean, you have to have it in you to be a doctor, because not everyone can do it. I mean, because it does require a lot of dedication. So, I mean, hats off to that.
Thank you.
So, sir, there's a lot of myths and fallacies going on related to COVID. Like, some people say, I don't know, it comes if you're it doesn't come if you're living in a hot country, or, things like that. There've been a lot of myths around. So what would you like to say about that? And can you tell us a little bit about what, COVID actually is, and this disease?
COVID, actually, it is a contagious disease. We all know that.
Yeah.
It spreads through droplet infections, and the pandemic which occurred, that COVID pandemic, it is due to the thing that it survives for a long time on surfaces. So it is like SARS-CoV-2, as we call it, severe acute respiratory syndrome coronavirus 2. And there's the family coronavirinae and coronavirinae. So it belongs to the coronavirinae family. So this coronavirus, actually, because of its long time survival on the surfaces, it is propagating all over the world. And the way I used to think about it, like, it's not near us. It started in Wuhan, China, then it went into US, and then it came to India. At that time, we were just listening about it, 1 or 2 cases. That time we didn't know that this will go like this. But when I came to know that in my surrounding, in my hospital, I'm noticing some COVID positive patients, and we have to shut our operation theaters, we have to shut our OPDs for some time. That if a patient comes over there and he's positive, then we have to we have to close it for some time, and then after 7 days we used to open it again. So then I came to know that it's an emergency. It's going somewhere else. We didn't know about it. It was something else that never happened before.
That's true.
And and we didn't know that where we are going, where we are heading to, what is happening, what is going to happen, or how many cases we will get in near future.
Mm-hmm.
But and in the start, I was also there wearing not wearing masks and all, and I was very casual about it. But when I noticed number of patients, and actually when I was working in the ward, there were around 140 positive patients around me. Then I came to know the
Oh my
emergency of the
God.
situation. Yeah, yeah, yeah.
Mm-hmm.
So it was quite thrilling, terrifying, and looking at the patients, their stories, it was something else. So it created a sense of responsibility in me. And yeah, I don't know where we are gonna go after this, what we are headed to in the near future. Uh, but we can just think that everything's gonna be fine eventually.
Yeah, true. Because I mean, it is right. Like, I don't think any of us have thought that, this pandemic was going to reach such a huge
Yeah.
situation and stuff. So, yeah, it is. Yeah, it's good to know about that. And can you tell me a little bit about the myth? Like, is it actually true that, if you're in a hot country, that it doesn't come? I mean, because from what I
No,
know, it's
actually,
not.
India is quite a hot country, though. India is quite a hot country, and we are
Yeah,
noticing cases over here. We are noticing deaths over here. Lot of, I mean, I'm noticing if we are in emergency duty, I'm noticing around 3 or 4 positive patients in casualty on a daily basis, and every day in every town, either it is having a small population or larger population, we are noticing cases over there. In the
Mhm.
hot climate too, actually, in the hot climate only, India got the COVID. The first case of the COVID, we noticed it in March. Actually, COVID started in March, and India is quite hot in those days, March, April, and all. So we can't say that it's completely a myth. I don't believe in that. And the people who are saying that, I think it's they need to get some good knowledge though about COVID.
True. And I guess that's why we have you here today, right? So you can, tell us
Yeah,
a little bit about it so we're well aware of it.
fine. Actually, I heard some people saying that you shouldn't wear masks, and if you are breathing in the mask, you will get again more infections. I have heard some things from on WhatsApp or on somewhere else, but I think this is actually not good for the whole community. Those who are spreading this kind of things, it's their irresponsibility on their behalf.
Yeah.
So actually, this all things are myths only.
Mhm.
Actually, using mask, using proper sanitization is that was always good for your health. Not only COVID. Actually, if you're using mask on a daily basis, it's good for your own health. You're protected from the pollution. You're protected from the other infections, not only COVID. And proper sanitization, I don't need to tell about it.
Yeah.
Actually, it's quite helpful for all of us. So yeah, everything that we hear like this, these are really myths, and there's nothing scientific. uh, there's no scientific proof for that.
Mhm. Yeah. So, could you please share one of your most unforgettable experiences during this time, like when you were treating patients or, anything like that? Just something that really stuck with you.
Mm, there are many things like that, but one thing I got stuck in that situation once. The first day, I told my parents that I'm posted over there. I have to go. I have to wear those PPE kits. I'll be in the positive patients, surrounded by them. I will be treating them. So actually, there was a quite fear in them that our son is going in a COVID, and we don't know that whether he'll be all okay or not. Actually, some of my colleagues went for the postings in the COVID ward and ICU, and after some time they got positive, and they were quarantined for 1 month. Some of them were admitted in ICUs. There's a government medical college, Nagpur. Some of my friends were admitted over there. So my parents knew about that. So there was a quite fear in them that how this is going to happen. But they only inspired me that you should go and you should work for them, because that is what they have done all their lives. So I think that was the thing, the first thing. And the second thing about the patient, one of my patient, actually, she was in the ward.
Mhm.
She was not that symptomatic. The asymptomatic patients, they're quarantined, isolated in the ward. And if they're having some symptoms, then some severe symptoms, or their oxygen saturation is low, then we shift them to the ICU. and some patients which are beyond that, which we can't manage here. So we send them to some other place in the other hospital which have all that equipment and everything over there. So such a hospital, a super specialty hospital is over there, which is converted in a place like where we can manage such patients. So the patient, that was a female patient around 50 years old, and her husband, they were admitted in our ward. The husband got quite serious, and he was referred to the super hospital. One day, that patient's son, that female patient's son, called me, and he told me that the patient's husband, means his father, he succumbed because of the COVID, and he was 20-year-old only. And he told me not to tell her mother that he was going to the funeral of his own father, and he was expecting me not to tell her mother that about her own husband, because he told me that she was a known hypertensive, and if such a situation, if she came to know that her husband succumbed to the COVID, so she won't survive. So I want my mother alive. So please, sir, don't tell my mother that his father is not there. That really touched me. Actually, in the age like 20 years old, I was not able to take such a responsibility, and the COVID actually uh, gave us a kind of sense of responsibility. We are acting as a community. It gave us a thing to act responsible and to care for each other. I, there are some things that we are isolated, we are quarantined, we can't go wherever we want to. We are stuck in one place. We can meet our friends, but it is giving us a sense of responsibility that we can, the way we are thinking, we are caring for each others. It is taking us as a community, as a whole community. The world is going uh, towards a better place, I think.
That is true. Um, your first patient, or did you have any patients before?
Actually, in ward, uh, actually we are posted in ward, normal
Mm-hmm.
surgery ward. If I am a surgery resident, I am posted in a surgery ward. So some patients are symptomatic, then uh, we send them for the RT-PCR, transcriptase polymerase chain reaction. We say that PCR, we do their throat swab for that, and after the sample comes out, if they are positive, then they are shifted to the COVID wards. Means it's a daily thing for us. Like if we found out that some patients are there in the surgery ward, and the saturation is falling, and they have some symptoms like they are breathless or what, then we send them for the throat swab, or now there is a new test, rapid antigen, we are doing over here, that we can get the results in 20 or 30 minutes. If the patient is positive, then we shift them to the COVID ward.
Mm, makes
So
sense.
around daily, when I started, when this COVID came to India, and when this COVID came actually to our hospital in Amravati, so at the start, there were some 2 or 3 patients, but then the patients, number of the patients increased, and then our duty started in the COVID wards. There was no earlier there was no ward. Then we made a separate building for it uh, to keep some such patients, and we shifted our normal wards to the another facility. So this is what how it happened.
Mm. So you mentioned that you work in the ICU ward and stuff. Can you tell us a little bit about how it works inside the ICU?
Uh,
And I
like
mean,
inside ward, it is actually we are there, means uh, there are 2 shifts. One shift we work in ward, and the other shift we work in ICU. The ICU is there are all the serious patients. We have to monitor them all the time using wearing our PPE kits. It's a 6-hour shift in the morning and a 6-hour shift in the night in the ICU. And if we are in ward, we have to make sure that every patient is fine. If he's not fine, if he's having some symptoms, then we shift them to the ICU. Actually, the patients are distinguished according to a scale. There are the groups A, B, C, D, and E. The A patients, type A patients, they are asymptomatic patients which are kept in the ward, And D and E, they're symptomatic patients which have their saturation falling all the time, they're breathless, they're coughing all the time. So these patients D and E, they're kept in the ward, kept in the ICU. Sorry. The experience was like, it was wearing that PPE kits. It is tough job wearing them for 6 hours continuously, and without drinking water. Actually, you can't change your PP kits like for in an hour or what. You will have to use it for 6 hours the whole time, and then only you can remove them. And in that situation, you have to go to every patient. You have to ask them. You have to put on the notes. You have to put on the medications. You have to give sisters the orders what they are gonna do, how they are gonna manage the patient. There are some other things also that we have to manage, like whether the patient is getting all the facility or not, whether he is entertained or not. Actually, that's the government policy, that patient should be entertained. He should not feel like he's away from the home. So it was kind of a tough job going to 140 patients, writing their notes, giving them the medications, and listening to them, whatever they are saying. So yeah, that was the ward thing. And in ICU, the patient is quite serious, so we don't talk much to the patient, but we have to monitor them for like 24/7. And then if some patient gets bad, then we have to start him with the ventilator or BiPAP machine, whatever there is. The availability is, actually we have 2 or 3 ventilators for the 6 patients, and 1 BiPAP. So we have to manage if according to the triage, like the patient which is having the more severity, then we will give him the ventilator. And if the patient is less severe, then we will keep him on the BiPAP, and the other patient we will start him in the O2 support. So this is the kind of situation which is there. But it feels quite good and satisfactory when you come back home, and it really feels very good. I mean, I can't tell you the satisfaction I get every day when I come back home, and how the relatives and all the people thanks you that the work you're doing and all. um, it's a humbling experience.
I mean, yeah, it is, very appreciative that you guys are literally risking your life. So it is really appreciated. And can you tell us any story about, I mean, you see, you must have had that one patient or two, I mean, like a couple of patients who you've treated and they've gotten better. So how do you feel when they come to you and they, thank you and stuff? So how
uh,
emotional does it get?
uh, no, obviously it feels really nice. I mean, it's another experience. And I mean, the happiness you get when you discharge them. Actually, the patient in the COVID ward are like, they want the discharge as early as possible if they're asymptomatic. They don't want to live over there. But when they go, there's actually many no patient. I didn't get in contact with any patient after I discharged them, because every patient was from somewhere else. They are just collected over here, and then they are admitted in our hospital. But some patient contacted me. One patient contacted me that, sir, it was nice that you served us like this, and I was feeling home when I was there also. One patient, he was he was having some situation at his home. Actually, his his all family was corona positive at that time when I was posted over there, and he was there and he wanted a discharge earlier. So I can't tell you this thing, but I discharged him one day prior. So he called me to that. Yeah, thank you for that thing, and I'll definitely meet you. It really felt good. And the patients, the coming patients are, I don't actually, the patients come in a lot, and we are discharging them in a lot. I mean, the 30 patient comes, we keep them in a isolation for 8 days, and then we make their discharges after 8 days. uh, so this is how it happens. And if a patient is serious, then I told you that he will be shifted to the ICU.
Right.
Yeah.
And so can you tell us a little bit about, when you first told your family that you were going to, I mean, you did mention a little bit about it, but like just a little bit more, because they must have had a lot of things going in their head, like, it's
Yeah.
contagious, it's this, and he's going to work there.
Actually, my parents are non-medicals. Like I'm not from a medical background, so uh, the medical. If a patient is from a medical family, sorry, if a person is from a medical family, actually their parents are quite. They know about this thing, like what is happening, how we are treating them, and whatever is happening around, and what's the real situation is. My parents were completely unknown about this thing. They were like, in my town, there's COVID is not that much reached over there. I mean, the way it is in the metro cities, it's not that much over there. So, but still, they were very fearful about the situation. And like the thing which were happening in Mumbai and Pune, that every home was having a positive patient, and the way the media is telling you the things that the patients are dying and all and everything. So yeah, there was a fear. They were frightened with the fact that I was posted. Earlier, they said ki if you can avoid it, try to avoid the duty. But I felt that if I can do that. If I want to avoid the duty, I can avoid it. I can just say that I don't want to work over there, and I'm not fit for that duty. But I told my mom that it's not the way you think. If everyone started saying no, then who will work over there? Someone has to, and they got that thing. Yeah, he's right. He's now he is responsible for not only his own family. That I'm not responsible only for my family, but I'm responsible for all the families and all the patients over there. And yeah, they allowed me after that. They were happy that I was working.
Yeah.
Actually, there was a thing. I went my home after that, after COVID duty and the 7 days of quarantine. I went home, and they were happy. My mom drew a rangoli for me. Like there was a Corona warrior, and he was holding his whole globe in his hands and a virus at his foot. So yeah, it felt good.
That is really sweet. Yeah. They must be very proud. So, yeah. And so, what does hard immunity mean? It's just a question.
And yeah, herd immunity actually. Herd immunity is you get the herd is what the community. We'll take it as like this: when the community, the 60 to 70% of the population in the community, it gets the immunization, or it gets immune to the particular disease, then we can say we got the herd immunity for this particular disease. Like it happened for the polio.
Mhm.
The polio vaccination was the basis of the polio vaccination was the herd immunity. We vaccinated all the population with the killed virus. So we the population developed a common immunity against the virus. So the community which was the population which was left, which wasn't immune, was very less. It was only 10 to 20%. And the possibility of the virus infecting the population decreased at a level which we can't see now. Means we can't see polio now. So it
Yeah.
will require around 60%, 67% is the right figure. That 67% of the population should be at least immunized or infected and should develop the immunity. Then only we can say that we got the herd immunity.
Do you think it's achievable here? Like, how do
Mm,
you assume?
the way it is spreading right now, look, the way the coronavirus is spreading now, I think the herd immunity, the concept of herd immunity, we can get soon. But there's a thing in that immunity which is being developed after the infection, it didn't last for long. I mean, now I read a paper which mentioned that the immunity after the infection is lasts for only 2 months. So we need a lifelong immunity to develop herd immunity. So I don't know how the vaccine will work, because right now we don't know how it is gonna be, or we don't have it in India right now, and there are not much paper published for the thing. But uh, right now I can't predict that whether herd immunity will develop or not. But the current situation, we can comment on it. We can't comment on herd immunity. It's quite difficult with the coronavirus. The way it is acting, uh, it's quite difficult getting herd immunity. We need to get the lifelong immunity for getting the herd immunity. Mm, with this 2 months of immunity, and after that nothing, I don't think it is going to happen soon. Let's hope that we'll get the vaccine soon, and which will give us immunity. And if we'll I, it might be a possibility that we will have to repeat the vaccination again and again after a year or two, and in that way we can develop a herd immunity.
Okay. So does this mean, if let's say eventually we will get the vaccine, so does this mean like even the people that got the virus will have to take the vaccine because their immunity is not going to last? Is that what it means?
Yeah, definitely there. We will need vaccine, and we will need to give them to the patients which were infected earlier as well, because we have seen the cases, the patients were infected again one more time with the coronavirus.
Yeah.
There are some cases, so yeah, we'll need a vaccine for them too.
I mean, we've heard that, there's a vaccine in Russia and all of that. Do you know anything about that?
Yeah, I know the name of the vaccine, that it's Sputnik 5 vaccine was developed and all, but the Russian vaccine reaching over here, we don't know, and the way the trial was undertaken, we don't know about that as well. And but if they have developed it, and if it is really working, so with the proper global communication and all, we will get it soon though. But it will need a mm, political involvement, lot of political involvement and global communication for that. So let us hope for the best, and let's wait.
Yeah. So how is the government supporting you right now? I mean,
Actually, the way government handled the situation, it's quite good actually. It's outstanding the way, because the healthcare system in India, we know how it is in the current scenario. But government, after the coronavirus hit India, the government was quite active in this case. They developed the sample collection facilities everywhere in the small towns, in small villages as well. There are so many in Amravati, it's not a much bigger city. But like it's not a metro city, but still here we have 3 to 4 sample collection units, and we are working day and night for that. It's actually today also our unit was all ready, all equipped with everything, and it the first time in the March when COVID hit India, the first case was in February actually, but in March when the isolation and quarantine started, at that time we were having no such facility, and in just 3 months we have so much facilities, so many isolation centers and quarantine centers, and they have done a miserable job in providing us with the PPE kits. It's quite amazing the way they have worked day and night for the. I think that in this situation everyone was very responsible and very responsibility work towards the best of the community, and providing masks and PPE kits. Earlier I went to buy N95 mask. It was very costly at that time, but now we can get it easily. The rates are also less, and we have increased the production of the PPE kits and N95 masks. Earlier it was one PPE kit we were getting for the whole day. Now we have number of PPE kits available at our facility now. So I think government is working quite good in this case.
yeah, it is really commendable. I mean, as you said
Yeah.
before, this virus has really increased that, sense
Really, yeah,
of
yeah.
responsibility and everything.
Responsibility, obviously, because
Yeah.
everyone is getting it. Poor, rich, whatever happens, it is happening to everyone. No one is spared from this virus. So actually, I think the coronavirus has united us in a good way.
Yeah. Well, it can be said like that.
Yeah.
I mean, it is said, right? In hard times is the time, when we come closer. So, yeah. Um, just a little lighter side. At the present situation, do you think it is commendable to open schools and colleges? Because there are a few, news articles and stuff that, it says on the news that some places have opened their schools and everything. So, do you think it's really commendable to do that?
Actually, education is very important for our new generation, which is coming. And if we completely shut down our education system, it's not the proper way to act. Uh, we have to find some new ways to propagate the education in the corner of the world. I mean, say all over India or the world, everyone is having the same situation all over the world. we have to find new ways, the online methods. Actually, the online method is quite going on, but it's not properly working. We need to find out some uh, proper protocol to propagate the education in the corners of India, because some places we don't have internet, and those children are affecting right now. They are staying away from the education. It is their proper right to get it. And right now, opening the schools, I think it's important to open schools, but it's quite unhealthy. I mean, if one of the student in the school, if he's uh, infected with the coronavirus, then 1,000 students are at stake. So it's not advisable to start the schools like this. But yeah, we have to find the new ways for this.
So, sir, you know how, vaccine research and all of that, it takes a lot of years. But at the rate at which Corona is going right now, I don't
Yeah.
think we have so many years at stake. I mean, so do you think we are rushing into it, or maybe we can give it, some
Yeah,
proper thought?
for the vaccine we have to rush for it actually, but the proper clinical trial should be done before. There are three trials for the vaccination: phase 1, phase 2, and phase 3. India has completed up to phase 2, and phase 3 we are into it right now. So I think if everything goes right, and if the proper people are working properly towards it, uh, s- so I think it's not that long that we will have our own vaccine soon. Mm, but it's quite the rushing into it. I don't think it's good for the community, because if something goes wrong, the side effects or whatever which will come in near future, we don't know about them. We have to wait, we have to go with the proper trials. But as the situation is increasing and growing, I don't know how it should be done or not. It's short of my hands. I am short of the knowledge about the vaccination right now, because we can't just predict that it is gonna be fine if we rush into it, or if it's not gonna be fine if we rush into it. It is very difficult for me to comment on it right now.
Makes. And sir, what is your view on having a health education class incorporated into school syllabus? How necessary do you think that is?
Health education is quite important actually. The proper method of sanitization, the uses of mask, the importance of it. Actually, just we may you mentioned before that there are a lot of myths around the health care, or the sanitization, or the coronavirus or other infectious diseases. So if we put health education classes, if we put that into the syllabus, actually these myths will obviously they will go down. I mean, no one will entertain them. So health education is very important, that we should the government should think about it. And actually there are some topics which will come into the syllabus in the near future.
Hmm. Yeah.
And
And
there are right now also for the health education there are some online courses, every doctor has to go through those courses. And I think the whole population should be that courses should be made compulsory for all of us, means all the population. Actually they are now compulsory for us, the healthcare workers, the staff, nurses, sisters, and the also the working staff over here. Everyone needs to go through that online course. But I think the population should everyone, every student, and everyone who is around, everyone should have those, everyone should go through those online classes for the proper sanitization and healthcare and all things.
that's good to know. And sir, could you please give us some tips and advices on how to protect ourselves from this virus? Like any home remedies, or anything feasible for common population?
Okay. Uh, Actually, the, the best way to prevent these situations are being to stay alone, not to go in the public meetings. Actually, there are some situations where we have to go, but we should use proper mask, proper sanitization, proper hand washing methods. There's a proper method to wash your hands. You should imply it every time we go in such public meetings. And there's also an app which keeps you informed about the current COVID situation around you. It uses your GPS, it uses your Bluetooth, and it tells you actually how many positive patients are around you in your 1 kilometer or 100 kilometer diameter of your residence. So we can use that app. We can use the technology in a better way, and yeah, this is the way we can prevent the coronavirus by spreading. And we should not go behind the myths and all. We should be responsible. We should take care of each other, and we should be actually, this coronavirus has made us very responsible nowadays, but everyone should think like that. Everyone should feel responsible. In the first place, if we use the sanitization methods, the situation which we are right now, we shouldn't be here. There are some people who are not following it. I think everyone should educate them. We should be educated in a proper way. We should educate people if we are knowing about it. So we should tell people that to use this proper hand sanitizers, steriliums, whatever available remedies we have in, like masks, N95s, whatever. We should educate people with this. And yeah, that is the need of the current situation.
That is good to know. And I think that is it from my side. So let's go to the audience right now. Guys,
Okay.
if any of you have any questions, please put it in the question box and I will ask. So, okay. So we've got a couple. So there is one. Hearing they are not postponing NEET exam, can this decision be dangerous?
Actually, if we follow proper social distancing when we are taking those exams, actually we can't delay the NEET exams now more. It's already very late, but there should be proper facility. There should be proper social distancing. There should be proper usage of uh, masks and sanitization. And I think if we are having such facilities, then we can go with the exam. We can go forward with the exam. But without having it going in a vague way, I don't think it's quite responsible.
Makes sense. So next question. When will the numbers start to reduce? Any big idea about it?
I think India is quite recovering from it. We are having more uh, recovery than the current infections. The more population is getting infected, we are having more number of recovering patients currently. So yeah, it will need some time. We have to give it some time, but eventually, yeah, everyone will be recovered. But yeah, it's a cycle. It will go on until we have some proper um, medication over it, or proper treatment for it, or vaccination. So we'll have to wait for the day when we get the vaccine.
This makes me curious. You know how we don't have proper medication and everything right now. So what do you actually use to treat the patient?
Uh, Actually, in ward, we are giving the patients the proper sanitization. First of all, we are socially making them distant from the society, and we are trying to boost their immunity. Actually, the virus, when it infects you, it's your immunity which works against it. So we are giving them the proper supplementations, vitamins, and uh, there are some other preparations, Ayurvedic preparations, which we do, which are given in the ward for boosting immunity. That's it. So this is the way we work in ward. And if patient comes with the symptoms in ICU, we are just trying to keep him alive with ventilators. We are giving him the life support that he can survive. When his immunity will work, uh, he will automatically revive from it. And there are some medications like remdesivir is there, which acts against the virus, but it's very costly. Some patients can't afford it, and government is not giving it to us for free. But there are some side effects too of that drug. But it's quite depends on your immunity, and if for to reduce the viral load, we use this remdesivir kind of medications.
So as of now, that is the most viable option we have.
Yeah, yeah, boosting immunity first thing, and symptomatically manage the patient the second thing.
Okay. So going to the next question, when should we get tested given that there are sorry, I can't read this. When should we
Asymptomatic.
tested given that there are asymptomatic people too?
Asymptomatic patients need not to be tested if they are not having any symptoms. But if they come in contact with a positive patient, and he comes with some symptoms, and if the patient is tested positive, then the person should be tested for the coronavirus.
So
And this infectivity actually comes after the 5 days, so it needs the time of 5 days. If I get in contact with the positive patients, I give my throat swab for RT-PCR after 5 days.
going to the next question, scientists have predicted that coronavirus would mutate. So can it be airborne?
Yeah, there's a mutation noticed in the coronavirus, and yeah, it is not airborne actually. It can't be airborne. It goes with a droplet infection. It lives on the surface. It will go through your nasopharyngeal secretions. No, it can't be airborne.
So to the next question, does the complete lockdown again, like the one which we had in the first all over country, required
Yeah.
again? Do you think it will be
Actually, I think the lockdown, the main thing why the lockdown was initiated at the first place, it was to get some time to make some facilities over here in India. We were lacking such facilities. We were not having any kits and all. So the lockdown actually gave us time to get prepared for such situations. It was not for avoiding coronavirus, because everyone was knowing that it's gonna come anyway. It was only the way to get some
sorry,
time for the
sir,
preparation for
you
the PPE kits and all, for the manufacturing and all. So now I think, and for the social distancing too, yeah, there was a part of it that it was needed for to avoiding it, but it was not possible completely to avoid it. Right now we are having the proper facilities. We are having proper isolation centers, and yeah, social distancing is important. It is necessary, obviously. But complete isolation and complete home quarantine right now, I don't think it's that much important. But if we are following proper sanitization rules and we are using masks, only then.
so there's one more question.
Yeah.
Sir, I think the question was, will there be a new normal? Like, do you think corona is gonna become like one of those diseases like malaria and dengue? Like, people are gonna
Yeah,
just,
definitely. Definitely, it's gonna be normal again, because it's the history, is the human history, that we have seen such infections before. We have seen the plague, we have seen polio, we have seen smallpox, and we got rid of it eventually. So yeah, there will be a new normal one day.
And how different do you think the new normal is gonna look like?
Mm.
Do you think people are, gonna stay away from each other, afraid to come close and, shake hands
Actually,
and hug?
I think new normal will be a better society. Actually, with a sense of responsibility. There will be generations to come. We will have story to tell them that we have seen the pandemic and we were in that era and we worked like this, and because of us, you are getting this life now. The way you are saying it, the way you are looking at it, we will have a sense of care for each other. We will have a sense of responsibility. Uh, and I think people will be more sanitized in near future, and so now also, and the healthcare is gonna boost, as we are having so much facilities after coronavirus. We can use those facilities for the other health for creating a better health structure in those places, the isolation centers and all. Uh, and the system which is working right now, if it works normally as well, if it keeps working like this, the healthcare in India will go on another level. So I think it will be a good picture.
Sounds good. And yeah, I think I'm looking forward to the new normal.
Yeah, we all are.
We all are. Yeah. And I'm just gonna look for questions again. Guys, does anyone else have any questions that you want to ask, sir? Um, let's just give it a couple of seconds. Okay. Okay, I think we've got a question. Yes. In Mumbai, with the floods and Corona all coming together, was there a sense of panic or hopelessness?
Uh, Actually, I'm not aware of the Mumbai situation, the situation which happened in Mumbai, but the situation which happened around me, yeah, there was a panic. There was a lot of panic. We shut down our OPDs in that we divided our whole department into like four different things. We were working for 7 days, and then we used to go for the quarantine for 15 days. And the other 7 other days, the other group was working, and then after that, the other group was working. And after 15 days, we used to come back and work. So yeah, that was a panic. Then we used to see our patients after their throat swab tests and after their we were doing our emergency duties properly, as if if there is a dire emergency, if you need a operative operation for a particular patient in emergency case, then we used to do it. But the elective patients which were there, they were affected quite a lot. We didn't get them into our OTs. Actually, if we get our elective patients are those which can wait. So if the elective patients, if we operate him without knowing his corona status, and if he comes to be positive, then the OT, we have to shut the operation theater, and we'll not get the OT for the emergency patients. So yeah, that created a panic amongst patients, amongst us. Okay, what is going to happen? What we are doing? And it was not quite ethical earlier. We were not feeling good about it, that we can't say no to the patient. If he's coming to us, we have to treat him. Yeah, from our head of the department to the smallest intern, which is working in the ward, everyone was panicked at that time. But nowadays, we are quite habitual to it. If someone comes positive, then it's fine, it's okay.
Yeah. So I'll take just one last question and then we can wrap it up.
Okay.
So as per recent reports, are loss of taste sensation and loss of smell initial indications of being affected with the virus?
Yeah, it was a symptom. It is the symptom actually. Some patient feels like that. Every patient doesn't come with that. A lot of patients comes with only a running nose. A lot of patients comes with the loss of smell sensations. Then a lot of patients come with headache. So it's the difference. Different. We can see a coronavirus infected patient. We can see a number of symptoms, and then we have to go for it. We have to do his prior chest X-ray. Then, if required, only then RT-PCR is the best thing which we have got now. And if in emergency, in case if the patient is very bad, then CT thorax, CT scan of the patient. It's like that. Yeah, the loss of sensations, yeah, it was there.
So I think that sums up the question and answer section as well. Thank you so much for coming, sir. And this is from the entire Anokha NGO. We really, really, really respect the work you're doing. And it really means a lot to us that, you know, you took your time to be here with us today.
No,
and a big, big, big thank you to all the frontline workers for the sacrifices you make every day, and especially during this pandemic. Your dedication, commitment, and courage deserve our deepest gratitude. We
thank you.
really
Thanks.
thank you, sir. Thank you so much for coming here
Thank
today.
you. It was my pleasure actually talking in front of you, sharing my experience, and I'm very happy that you gave me that opportunity to speak in front of you. It was really a humbling experience. Thank you
It's
so
our
much, everyone in the Anokha NGO. Thank you.
We got to learn a lot from this, so it's been a great experience. So thank you so much. And yeah. So lastly, Audience, that was Heroes Without Capes. Hopefully, now you got a gist of how it's like to be in the front lines. Thank you so much for attending our session today. And this is Dave Viyuru signing off. Thank you.